to join, Shelly. Oh, are you there?
I'm here.
Okay, let's try this again.
Sorry about that.
How are you doing today? That's
Good. How are
okay.
you?
There's always something. I'm good. I'm so excited to have you. You have so many amazing qualifications, and I know you can really help people with so much
Mhm.
different things. A lot of my audience is either trying to get pregnant or currently pregnant or recently had a baby. So it's not just about charting their cycles. It's all that stuff, right? There's so many things to learn when you have a baby, for
Right.
sure.
Exactly.
Did you, yeah, yeah. Did you want to introduce yourself to everybody?
Sure. So I'm Shelly. I am a doula, family educator, and international board certified lactation consultant, and I'm also an infant sleep educator. So basically, if you're pregnant or you're a new parent, I've got your back.
Yeah, that's
Um,
great. That's amazing.
So I have a private practice and an online membership community for expecting and new parents. And my husband and I are raising our kids just outside of Boston.
Nice.
And, and we have a
That's
dog that's really annoying, but that's pretty much it.
Oh, that's funny. Yeah, that's so amazing. Well, we can talk more about what kind of services you have at the end, if you'd like. I would love to just get started with, what I mean, specifically, I was thinking of talking about breastfeeding because I know
Mhm.
that's something a lot of people sometimes struggle with. I'd love to know, like, what are, I guess, some common myths around breastfeeding or common situations that you see that would be interesting for people to hear about?
Hmm. I think the most common, I don't want to necessarily say myth, but maybe misconception is that breastfeeding is the easy part,
Mm.
that the birth is the hard part, and when that because breastfeeding is natural, that the babies just come right out and jump on the breast and everything's good to go. And for a lot
Right.
of parents, that can happen that way, but
Mm.
not so much for many parents. They struggle.
Hmm. Yeah.
So if you do find yourself struggling with breastfeeding, you're definitely not alone. Um, a lot of families struggle if they didn't, like if it was easy, I wouldn't have a job.
Yes. That's for sure. And they're so lucky to have you. I know a few of my friends had some problem and they were so happy to have someone who actually come in, look at like how they are like holding the baby, I think sometimes is a big part of it. Is that what you do? You help with like latching and all that kind of stuff?
Yeah, or if baby's having weight gain issues or trouble transferring milk, pretty much anything.
Yeah.
Also do bottle consults too, if the baby's struggling to take a bottle. Um, but yeah, I think another myth around breastfeeding is that it's supposed to hurt, and it's not. I know
Mm.
a lot of families are told like, oh, the first 2 weeks it hurts, but if you can get past it, you're fine, or the first 6 weeks. But breastfeeding shouldn't hurt at all. There may be some tenderness and soreness in the beginning, but you shouldn't be like curling your toes and crying into a pillow every time you put your baby to rest. Something's wrong if it hurts.
Hmm. Hmm. Yeah, I actually had that problem myself. Like, I think in the beginning, I somehow got damaged the skin or something, and so it was really, really painful to attach for the first week or so, but then it did get better. Um, and I think the skin maybe just needed to heal. Is that how that happens?
Yeah,
Or
it only takes like one bad latch to damage your nipple, and then until you fully heal, you're gonna be in pain, at least in the
right.
beginning of the feeding. But
Yeah. Yeah, that was hard. I can definitely see how that can put people off for sure.
right.
Especially if you don't have support, like someone like you, right?
Mhm.
Um, I mean, in what situations do you think would be useful to ask for help? So I guess when it's in pain or a baby's not gaining weight, what else would you recommend?
So if you have risk factors for low milk supply, then having a prenatal consult would actually be really helpful because an IBCLC can sit down with you and go over your options and what breastfeeding might look for you based on your risk factors. So like PCO, I know you talk a lot about PCOS on your page. So like having PCOS would be a risk factor for low milk supply, or having thyroid issues or a history of breast surgery. Um, Infertility can be a risk factor for a low milk supply. And unfortunately, even though our providers are supposed to be going over this with you, like your OBs and your midwives, that doesn't really in the US. So
Hmm.
you're kind of, a lot of families are left feeling unprepared for any struggles that they come up with because there was no one there beforehand to have that discussion with them. To say, like, because you have this history of PCOS, you could have a low milk supply. Although a lot of women with PCOS also have oversupply. Like, so it can go either way. But if you
Right.
go in knowing, okay, I have these risk factors, and here are some things prenatally that I can do to reduce those risk factors and increase the risk, increase the chance of making a full milk supply. And you're prepared for what it might look like, then there's less chance of things getting worse than they would normally for you.
Hmm. Hmm. What is it about? I'm curious because I do talk about PCOS a lot. What is it about that that can affect the milk supply?
So, depending on the severity of PCOS, it can affect your breast growth, particularly during puberty and pregnancy, where you have a lot of growth of like fatty tissue, but not a lot of growth of the tissue, the kind of tissue that ends up making breast milk.
Hmm.
Thyroid issues can also run hand in hand too with PCOS, and low thyroid can cause low supply too because your thyroid is responsible for releasing the hormones that make milk.
That's amazing. I never knew that about PCOS affecting breast tissue growth. That's
Mm-hmm.
really interesting. Yeah, I'll have to share
Right.
that with people for
And I want to
sure.
be clear that if you have PCOS, it doesn't mean 100% sure that you're going to have trouble making milk. It's just, it's a risk factor that you should be aware of, and you should have that support
Yeah.
ready to go.
Hmm. That's interesting. And so, what can people do prenatally, like you mentioned, ahead of time to reduce the risk of that happening?
So a lot of what I do with families prenatally is based on their individual health history, and individual circumstances, and also their individual goals. But in general, if you have a low risk pregnancy, you can start hand expressing colostrum once you hit 37 weeks. And that hand expression of colostrum during pregnancy has been shown to help increase milk supply after the baby's born. And you can even collect it and jar it up in like a small oral syringe and bring it with you to the hospital so that if your baby does need to be supplemented, you've already got some colostrum going and
That's
available.
great.
Um, there are certain herbs that, depending on the parent's medical history, might increase the amount of breast tissue that they grow during pregnancy that does make milk. So a lot of studies have found that there's a specific herb too that if you take, it increases your but you have to take it prenatally in order for it to be really effective, which is why I always encourage parents to reach out prenatally. If you come see me
Hmm.
before you had the baby, there's a lot more I can do for you than if you come to me after.
Hmm. Yeah, that's amazing. That's so great that you I had no idea. That's really, really good. Um, yeah, I mean, I think it's like with anything, you want to ideally plan ahead, right? And
Mhm.
have a plan. Hopefully everything goes well, but just in case, so you know what to do.
Right. And
I think
we might set up a plan for like having the parent pump right away, which is not something we usually recommend. But if you have a little, a risk factor for low milk supply, adding in that extra stimulation might help, things like that.
hmm. Yeah, that's really, really great. As I think a lot of people don't even think about it till after they have the baby and they're already struggling.
Hmm.
So yeah, that's
Right.
really
Like
good.
one of my intake form, one of the questions is like, did you have regular periods when you were growing up, or irregular? Because if you were irregular, that might be a risk factor. It's all part of the
Mhm.
reproductive system, right? It's all part of the same system. So if you're having
Yeah.
trouble with your cycle and you're having trouble getting pregnant, you might have trouble making milk. It's the same system.
Hmm. That's so true. That's so true. I never thought about that. And I think during labor, also one risk factor, I believe, is if you have too much bleeding after the birth. Is that correct?
Correct. Yeah. So your milk is made from your blood. So if you lose a lot of blood during labor or have a postpartum hemorrhage, your chances of making a full milk supply do go down. A lot of times I do see that it might not be a low milk supply, but it might be delayed coming in. So instead of your second milk coming in between day 3 and day 4, maybe it comes in between day 6 and 7. And when it does come in, you've got a full supply, but it takes a while to come in. Same thing with C-sections, that can delay your milk coming in. If you get a lot of IV fluids, that can delay your milk coming in. If you had a very long, hard labor, that can also delay your milk coming in.
Hmm. Yeah, that's so fascinating. Yeah, I think you're right that people don't think about the stuff ahead of time and they just usually come to you after they're having problems.
Yeah.
So it's always good to plan ahead. Yeah, I mean, I guess I'd love to know, you said you have is it an online membership group? Is it just for people locally or just for people who are pregnant or who's eligible for that?
It's for all over. But there's like, you get all your prenatal classes. So we have our childbirth ed, our prenatal breastfeeding class, our prenatal sleep class. We have an infant sleep class, newborn care. Those are all held live on Zoom, and that's included in your membership. And then we have
That's
weekly
amazing.
and monthly support groups. And we also have recorded classes like picking a provider, writing your birth plan, and then for
Hmm.
after the baby arrives, we have a different set of courses like how to prepare for going back to work, things like
Mm.
that. And that's all included in the membership. And then
Hmm.
there, we have a monthly guest expert every month, as you know, because you're going to be one of our guest experts.
Yeah.
So actually, like this month, because it's not just for breastfeeding families either. So like this month, our guest expert is Mallory from the Formula Mom. I don't know if anyone here follows her on Instagram, but she's going to be talking about like how to choose the best formula and how to pick the best formula. So it's not just for breastfeeding parents, the membership, it's for all
Hmm.
parents.
Hmm.
And then last month we had a baby concierge planner talk about like creating the perfect baby registry and what you really need and what you really don't.
Yeah, that's great. Yeah, there's a lot of stuff that's marketed to new parents. It is very unnecessary.
Yeah. You walk in and they give you like an 18-page list of like, this is everything you need on your baby registry. And of course, when it's your first baby, you go and you put everything on. And then by the time you
Yeah.
have your third baby, you're like, oh, I'm due next week. Maybe I should start finding where all the baby stuff is in the attic.
Yeah. As long as you got diapers, you're fine. Right?
A couple ones,
Yeah, the rest.
places for you're good.
Yeah, exactly. Yeah, that's so amazing. I guess, yeah, I wasn't thinking of that. It's because you're a doula, you can do everything, right? Because you've got all the education on the different aspects of baby care, and it's so great you have all the experts coming in as well.
Mm-hmm.
It's really, really good. I love that. I love that. I might have done something like that when I was pregnant if I had known you.
Yeah,
That's really good.
I wish I had that one. But that's why I started.
Hmm.
That's why I started in this profession, like because I struggled a lot when my first was born. I had postpartum depression. I felt very isolated. Was living out of state from family.
Hmm.
None of my friends and family my age had had kids, so my daughter was actually the first baby I had ever held, and I felt like
Hmm.
I have no clue what I'm doing, and the support system in our country in the U.S. unfortunately can be lacking. Um, so it just made me realize like how little support there are for parents, and that's what kind
Hmm.
of like got me going down this field.
Yeah. So creating the program you wish that you had had for yourself.
Mm-hmm.
Yeah, I think that's how a lot of people get into health care is because it's something that they've experienced and they want to help other people do better in the future. So that's
Right.
really, really good.
I don't know any
Uh,
little kid that's like, I want to be a lactation consultant when I grow up. It's kind of something you just fall into.
yeah, I don't think they teach little kids that that's even a job, really. They should, though.
Well, just like your
They
job,
really
right?
should.
That's probably not
Yeah.
something you're thinking you wanted to do when you were a kid, but it's so
No.
important. And I feel like some of the most important jobs that are like undervalued are the ones that people just fall into because they find out through personal experience, like this is an area that's severely lacking
Mhm.
for
Yeah,
whatever reason. Mm-hmm.
yeah, for sure. Um, so I did have one person send me a question. Oh, I love your mug, by the way.
Yeah.
That's amazing. That's perfect. One person asked a question. They said it seems like spit up is at its peak around 2 to 4 months ish, or maybe it was with their child. I'm wondering if that's normal or why it's like that.
Yeah, 2 to 4 months is definitely an age of development where things like shift inside the baby's body as they grow and they go through developmental leaps, where all of these throat structures tend to be immature to begin with because they're babies. But sometimes like they hit a certain point of growth where they can become even more loose and you'll see an increase in spit up. And that,
Mm-hmm.
as long as your baby's growing and happy, like a happy
Mm-hmm.
spitter, then it's nothing to worry about. It's just a laundry issue more than anything.
Yeah.
Just
That's
wash
good.
less.
Yeah, I know like sometimes with mine it was like just a little bit here and there, but sometimes it seemed like their entire stomach got emptied out and it went everywhere. So I don't know if that was maybe part of that growth phase that you just talked about, or
Yeah.
could
And
be.
babies are like us. Sometimes we eat a snack, sometimes we eat like a 5-course meal, and then we're like, oh, I kind of regret that. And for babies, they give you a refund. They're like, oh, you can have some of this back.
Yeah, yeah. Actually, I love that story you posted. I don't know if it's a story or a reel or something you did a while back about. Oh no, that was sorry, that was about diapers actually exploding in the car. Similar thing, right?
Oh,
It's a
yeah.
laundry issue. It's not fun to deal with.
Yeah.
Yeah,
My son
yeah.
was
I think
huge blowouts. Huge blowouts. Yep.
yeah, yeah. Fun. I think we've all been there if we've got kids.
Mm.
Yeah. And my oldest just yesterday, she's 3, we were walking in the park, and somehow she got dog poo on her hand. So it's like poo is always an issue
Well,
somehow.
at least you weren't like, is it dog poo or chocolate? And then
Yeah, I did not do that.
you're
I
not
did
that kind
not
of
do
brave
that.
mom, huh? Because neither am
I use my
I.
nose.
Yeah,
Yeah.
smarter choice.
Yeah, it's kids are messy. I think that's something you have to just kind of stop trying to control that and just accept that kids are messy. There's a lot of laundry.
Yep.
Yeah, for sure. Well, thank you so much for coming on. I didn't really have any other questions come up, but it's great to hear from you, like when people should seek help and sort of ideas to start planning ahead. Because I know a lot of my people in my audience are definitely trying to get pregnant right now. So
Yeah.
that's really, really helpful.
And
Thank
I
you for
do
that.
have the link in my bio. I do have a free prenatal screening for low milk supply risk factors. So you just,
Okay.
people can just download it and it's just like a quick checkbox questionnaire. And then it will tell you if you have any risk factors for low milk supply and what the next steps should be if you do.
That's great. Awesome. And so where can people find you?
So I'm on Instagram at Shelly Taft IBCLC. You can go ahead and follow me there. I'm usually in my stories every day. I do Q&As twice a week, and I post almost every day.
That's great. Awesome. Well, thank you so much for coming on, and I will probably be talking to you soon.
Thank you so much.
Okay, bye.